Coming up today, the most advanced tools require experienced hands. We look at the latest robotic technology and the expert surgeons at the controls. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. If you need to be on the operating table, then you want that surgery to be as minimally invasive as possible. It means smaller incisions, quicker healing, less pain, and often better clinical outcomes. Robotic tools have already revolutionized surgery, and they keep getting better. But these robots aren't autonomous. They're only as good as the highly trained surgeons who keep complete control. We are talking with one of those surgeons here today. Dr. Mobin Mirza is a urologic oncologist here at the University of Kansas Cancer Center, and he is the director of the robotic surgery program at the University of Kansas Health System. Aaron Rapel is the clinical nurse coordinator for the health system's robotic surgery program, and Douglas Chisholm is here as he's going to share kind of the patient perspective with us. Good to have you.
Thank you.
Good to have all of you. He has actually gotten 2 different robotic surgeries, including one with Dr. Mirza. Doug, let's just start with you and your experience. One surgery was for your kidney, I understand.
Correct.
The other was for your prostate. Which came first? And just kind of tell us a little bit about what was going on with your health at that time.
Okay. Well, my journey kind of started relatively healthy, 61-year-old person, and anyway, I was frequent urination at night and felt a little pressure in my back area, so I thought, you know what, maybe I better get a physical, which I hadn't had for a few years. I've kind of neglected that, so I went and got my physical. The results came back. I had an elevated PSA. I think it was 5.4, something like that, and so my my local physician said, let's just watch it a little bit longer, so we watched it for like 6 months, and I went back in, did another PSA test, and it went up to 6.5. So at that time, he referred me to a urologist. I had had a friend who had actually been through a little bit of the procedure before, and so he recommended KU Med. So we got the ball rolling there, and I actually we set things up and went through the test. I met with the KU staff, and they indicated that they thought I needed a biopsy. So we went ahead and went through the biopsy, and it came back that I had cancer. And so they recommended that we start that procedure pretty fast. So I was fortunate enough, and again, I'm just going to say blessed that I ended up with Dr. Mirza. We went through CAT scans, PET scans, whatever, everything that I went through, and it was determined at that point that I did have prostate cancer as well as kidney cancer. I had a spot on my kidney at that point. So we met with Dr. Mirza and kind of looked at the situation, went over all the options that we had before us, and so that kind of started the procedure where I'm at.
So you were diagnosed kind of at the same time?
It started with the prostate, and then the scans revealed that I had a spot on my kidney, and so 2 things. I guess I was blessed. I'm blessed to have the prostate to identify the kidney problem.
One found the other, if you will. What was that like for you during that time?
Obviously, very nerve-wracking at the time, because the prostate, which again, I've never been in the hospital, I've never had health issues, so obviously when you get diagnosed with cancer, it's like, a shock. And then when the results came back that I actually had on my kidney, then you always think the worst, does it metastasize to spread through my body, or, what the situation was. But I was very fortunate. Dr. Mirza got me in quickly and put my fears at ease that we thought there were actually 2 separate, oddly enough, there were 2 separate cancers. And he explained with my wife and I, we sat down and he explained, what the procedures was going to be and give me several options, and so we proceeded there.
And what were you told about each surgery ahead of time, especially in regard to this robotic assisted surgery?
Well, and again, Dr. Mirza, I can't say enough good things about him. I mean, he just literally brought it down to our level. I'll never forget, and I joke about it now, but he brought out a piece of the bed table or whatever it was, and we drew the charts and everything, and he gave me options. He didn't push anything on me. He said all options are, the results are good any direction we go, but the robotic just seemed like obviously the recovery time was one of the main reasons. and just the preciseness of what the robotic could do, and that was, at that point, it was just kind of a no-brainer.
Yeah,
Just
he put you at ease?
Yep, it did. He resolved all fear. I mean, we walked in there, and when you get the cancer diagnosis, you're obviously, fear and everything else, you expect the worst, and my wife and I both commented when we walked out from Dr. Mirza from our meeting, there was a calm over us, and he presented that calm just like very confident, very straightforward. But he's like, we got this. This is, I remember the word he told me that I really liked was, a year from now, this is going to be a bump in the road. You're going to be back, and I'm 6 months out, and I already feel that right now.
You're going to be back, and
Yep.
you're a school administrator, so you're back at
Administrator.
school?
Yep, school administrator, back at school. I don't have any side effects. I mean, I'm good.
You said you're back to the kids playing Foursquare with those young kids, you said.
Yep, at recess duty, and
I like that.
Have fun every day.
I like that.
Enjoy it. Yep.
Dr. Mirza, robotic surgery, of course, is not brand new, but it's getting more and more common and much more advanced, as we know. But the big picture, kind of give us an idea of how robotics has changed the field of surgery overall.
Yeah, this is a revolution in surgery. And if you go back to the late 90s, early 2000s, we did everything with big incisions. Laparoscopy was getting more advanced, using ports and cameras. So the problem with laparoscopic surgery was that not everybody could do it. It was hard to do. The instruments were harder to use. Precision was hard to make because you're working with long sticks. So at the end, that's all you can do with something. So robotic surgery was a great investment because now your tools are more precise. You have all wrist movements with your tools. You can get down to this close with your camera to look at something, you can magnify it. So robotic surgery provided that precision. The Science and Technology Museum in DC actually has the robot in the museum, like the initial robots that were used are now in the museum. So that's the impact on the history of surgery. Like now you can see it in a museum and say, oh man, this is what changed about surgery. So it's been a huge revolution. And now, we're at that point in history of surgery where, before we used to say, what can we do robotically, let's apply it. And now we say, what can't we do this way? Like, is there anything left that we cannot do with precision instruments, minimally invasively, to help our patients recover better, faster, and get the best outcomes possible? So that's where we are now.
That's cool. Cool that we're already being able to tell the history lesson.
Yes.
I like that.
Yeah.
Erin, how many robotic surgery cases are we doing here at the health system?
So we do over 140 robotic cases at the main. And then last year in 2024, we did over 1,600, but we expect that it's going to be higher this year in 2025.
So Dr. Mirza, how does the robotic surgery actually work in the OR? Kind of walk us through what we're seeing here.
Yeah, so it's actually very hard for people to understand sometimes, not because the concept is hard, but because your surgeon is not really with you. Mm-hmm. So, the patient bed is where the patient lays. The anesthesiologist there, we have a team that's right there, the surgical tech, an assistant on the bedside. And then we put in, cameras into the belly, and then we have little portholes that have instruments that go into them. And then we control the instrument sitting, 6-8 feet away on a console. And in our setup, we're sitting 6-8 feet away, but you could be sitting 600-800 miles away, and it still won't matter. You could still do the same thing because the control is at the level of the patient. That's where it's being executed. But everything that you do to enable that movement from the robot is happening from the console. So as long as it's connected and communicating with the robot, you can do it. Now, saying it's robotic is sort of a misconception because there's nothing robotic about it. It's not doing anything automatically. It's really, a slave machine. You're using the machine to do the work and you're controlling the machine. So the idea that it's robotic, it makes it sound advanced, but technically it's not a robot.
Not a robot.
Yeah, it's not an autonomous thing that you just
Correct.
Patients always think I'm going to set it, I'm going to go drink coffee, it's going to be in 4 o'clock, come back. Yeah,
You're not hanging out. You're not on a coffee break. Good to know. Erin, what kind of setup is involved for each of these cases?
Same as you would do if you were doing an open procedure, except there's just 2 extra steps. One is that you have to make sure that the robot is plugged in and working correctly with the monitors in the room. And then, of course, our surgical tech is going to have to drape out the 4 robotic arms in the column on the robot. But other than that, setup is just like any other surgical case.
Dr. Mirza, you were describing kind of what it's like to sit at that console and control those arms. But from a surgeon's perspective, how how different is it from kind of what we think of as that regular laparoscopic surgery?
Yeah, I mean, from a laparoscopic surgery, in terms of control, one, you're at the patient's bedside, so you're standing right there and working. And your instruments are going to be, I don't want to say rudimentary, but they're harder to use because you don't have movement. Like, there's only so much you can do at the end of a stick, right? With the robot, when you sit there, I don't want to say it's like playing a video game because I think that would really demean the process. But I think that's how people can think about it, to say it's sort of like playing a video game where whatever you see on the screen is what you're controlling, and you have good precision control of it. I can move something, a millimeter or less. I can take a grape and like peel it with just my scissors, and when I can do that for a patient in terms of nerves, lymph nodes, blood vessels, cancers, whatever it is, it just provides that really high level of precision for us. And the first time you sit on it as a trainee, everybody's reaction is just like, wow, like what me looking with with my eyes, me looking with a camera on a laparoscope, and now me looking through this console screen is a world of different experience. You just went to a 4D world at an AMC theater. Like, you just like, everything is right there. And now with the newer technology, even the exchange, like the audios and stuff, the console work is just tremendous, and it's like you're like in this high-tech world, and you get excited every time you sit on it.
Yeah, no, explaining it that way, that's how us regular folks, that's how the Nintendo world is how you have to describe it to us, or the AMC movie
Yeah, so that's
experience.
a good analogy. So think laparoscopic surgery is like, the Nintendo of 1988, which I used to play.
I know, that's so old school. I'm sorry, we just dated ourselves,
that's okay.
didn't we?
And think robotic surgery is like, the Xbox that my kids play.
Okay, that's
the difference.
Okay, thank you. Let's get us up to date,
we
right?
went from 8-bit graphic to like reality.
Okay, good. Let's get us up to a little higher technology, right? So let's talk about the patient. What is it about this robotic surgery, though, that really leads to that quicker healing and those better outcomes?
Yeah, I mean, it's very, you think about doing a open surgery where the incision's going to be bigger, there's going to be splitting of muscle tissue, and even in open surgery, we can make a small incision, but in order for us to work in there, we're really expanding the cavity to be able to look inside. And then my view is from here to here in an open surgery. Like, I got to look under things, over things. And this is especially true when we do robotic prostatectomy, for example, because all your work is deep in the pelvis. When you get in it with the robot, instead of me looking this far away, now I'm looking this far away. My camera is sitting right in front of the tissue. And if the bone is over me here so I can look over it, well, I'm actually under it at that point. So, I mean, simple things like that just make it so much different for the patient experience at the end. I mean, they're not seeing what we're doing when we're working on them, obviously. But when they wake up, like, they don't have big incisions, split incisions, everything happened in a very precise way. So the pain control afterwards is much, much better. We used to keep our patients in the hospital maybe 2 or 3 days for some of these surgeries. It's an overnight hospital stay, and honestly, for some patients who are rock stars, they could probably go home the same day. And we could do that, but we don't always do that. They can walk faster. The effect on their gut and bowel movements is not as bad. So things move quicker. So instead of saying, hey, you got to take 6 weeks off of work. For kidney surgery, for example, I told Mr. Chisholm, 2 or 3 weeks, you'll feel pretty good. You'll just have to remember what I told you. Don't do anything really silly, but you'll be fine. You'll feel just as good as when you walked in.
All right, let's ask the rock star.
Yeah.
How did it go?
Absolutely, that was the truth. I had surgery on a Tuesday, and there was a big snowstorm coming in February, and they let me out Wednesday morning so we're about an hour away to beat the storm. I went home. I felt pretty good. The first day on Wednesday was a little bit tough, but then Thursday rolled around. We were actually out of school on a snow day. Friday, I felt great. Actually went to a basketball game on Friday night and started back to school the next week. And I had absolutely, it was amazing. I guess my whole problem was I felt so good that I just wanted to do things, and I couldn't lift at that time. Dr. Mirza again reminded me that take it easy, and so that was the toughest part because I felt well. I walk a lot. We started walking 3 days after we were back out to walking a couple miles, and so it was absolutely amazing.
So you were being a good patient.
I was trying to be. The toughest part, I have grandkids, and so I wanted to pick them up, so I couldn't do that. That was the toughest part. But the prostate was a little more in detail. the recovery time was a little more simply because of that foolish catheter. If we could do something with that thing, you know, that would have been easy, but we had to keep that in a few days after the surgery. After that was out, again, I returned to work really with no restrictions. I didn't, again, lift things, but felt absolutely amazing.
And Doug, how is your health today?
Great.
Kidney,
I'm back to doing everything.
prostate good?
Absolutely. Everything is normal, back to doing. I mean, I know it's just been a few months out, but it's amazing, you know, and I know there's questions about the scarring. You know, they were little incisions, and those are already starting to heal to where you can still see them a little bit, not bad. So absolutely, again, amazing. I feel great.
You look great.
That's what people say. They can't believe that. It's just been a few months, but you know, the recovery time was unbelievable.
Great.
Yeah.
Well, Dr. Mirza, of course, they don't let just any doctor use these robotic surgery machines. So what kind of training goes into this?
Yeah, the training is, along with the technology improvements over time and just the landscape changing, has also changed. You know, when I graduated from residency, again, not to age ourselves too much, I did not have any robotic training in my residency. It was very minimal. We just gotten a robot when I was about to graduate residency. So you needed to do more training to be able to use these platforms. So I did a fellowship afterwards. My fellowship is in oncology, which is another point I want to make here, and that included the robotic surgery part of it. So I did extra training to figure that out. For my residents these days, and the residents in the other programs that are involved in robotic surgery, whether that's GYN, general surgery, cardiothoracic, colorectal, whatever our training programs are, these trainees are coming pretty well trained now, and you know, they don't have to gain extra training after their residency programs to learn how to use robots. That doesn't mean that they're experts in their field, and I think that's what the University of Kansas Health System and our program brings to the table, which is our surgeons are not only good robotic surgeons, excellent robotic surgeons, experienced robotic surgeons, which is important. I think the most important thing is that they are experts in their field, whether that's oncology, whether that's urogynecology, whatever it is, they're experts within their field first, and then they're excellent robotic surgeons. And I think even though we're talking about robotic surgery, I think that's almost secondary in a way, because being the expert in the field first is important. You take an example like Mr. Chisholm here, you know, you've got two cancers, two potentially bad cancers. Like, how do you put these in order? How do you diagnose them? What testing do you do? How do you figure which order you're going to do things in, which is more important? I think that amount of complexity in standard hands is not possible. That's what you get here. The other thing you get here, this is shown by data over and over again. When you come to high volume centers like ours, your outcomes are going to be better. There's no question about it. When you come to a center where your teams are in tune with what you do, so yes, the patient meets me, but his treatment team is 10 other people. There's a surgical tech, a nurse, Aaron, the anesthesiologist. We're not there for the first time doing this or the 100th time doing it. We're doing it for the 1,000th time or the 2,000th time, right? So I think that idea of experience, repetition, adjustments, all of those things become really important to the patient outcome, and we have good data that shows that that's important. So I think that's what you're getting in us in this high volume center with experienced robotic surgeons who are experts in their field. And I think that's what you get, and that's the brand, right? When you think of any brand that you think is reliable, you don't question it past that. You say, okay, I'm going to buy a Honda Accord. I know this is going to run, you know, until I can run it into the ground.
Yeah.
So when you look at our brand, which is the University of Kansas Health System brand, when you come in to consult with a surgeon, or you came to see an oncologist first. We talked about surgery second, right? So when you come and see the experts first, that's the brand you get, because everything that follows is going to be reliable, it's going to be unbreakable, it's going to be controllable, and you'll get all that precision medicine combined into that process. So I think it's exciting.
Wow, you said that perfectly,
Yeah.
perfectly. Aaron, I was going to say how many surgeons at the health system have that level of training, how many surgeons and their team, like you, have that kind of level of expertise?
Oh golly, I don't know if I have the whole team number, but I can tell you that we have 47 robotically trained staff surgeons here, but that's going to be well over 50 because we have a number of them applying for privileges. And that's just at the main. We're not talking about any of our sister hospitals of Liberty or Olathe.
So we're talking 50 surgeons, and like you said, the shout out to those 10 staff members surrounding each of those surgeons that are taking care of our patients like Doug. The health system started using the newest model of these surgical robots called the DV5. Dr. Mirza, what are the biggest upgrades to this new model? What are we looking at here?
Yeah, I mean, the DV5, the best thing it does is it charges my phone. I love that.
Perfect.
Yeah. No,
it's good for something. I love that.
It's good for something. No, so I think there are certain improvements in the DV5 which are just visible from the outside, which is just the ergonomics for the surgeon, right? You got a better console, you got a better feel, it charges your phone, your ability to sit, see things, the camera optics, all those things have improved. But what the DV5 really offers us now is a way to learn surgery. And you're going to say, well, Dr. Mirza, you're the expert. Like, why would you need to learn surgery? We're all in an iterative learning process, trying new things, trying to figure out what could be better, right? And what this does, it combines a lot of AI and software. So if I do a surgery, it'll record the surgery, it'll record my movements, I can bookmark it at certain steps. And then when I do it the next time, it'll say, hey, this is what's changed. And this is what you could do better. And what you can do better, you know how you can exercise it? And it's going to throw an exercise at me to sort of work on it to say, okay, this is where we're struggling a little bit. You could provide a better nerve-sparing procedure here. You could have saved this bleeder here, right? So it'll provide those kind of details for us in an iterative process, so we are constantly learning. That applies to me, of course. It also applies to my trainees a lot more. So now instead of me just saying, oh, don't pull that, don't touch that, I can say, hey, look at this video, and now do this exercise.
Like
Go
on the
back
spot.
to it. Yeah. And now it's just not, the 50 of us robotic surgeons who work here. This amount of data is, the thousands of robotic surgeons across the world who are doing this. And we're going to be able to pool our, videos and our data together to say, if something simple that you were always used to, you're like, well, why didn't I think of that before? Like, that should have always been the case. But now we can discover those things where, things that are obvious to us, things that we're improving, can come from the brain trust of the robotic surgeons of the world instead of the 50 of us who work at this hospital.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Aaron, with this new system, what safety features are built into it?
Oh man, hundreds and hundreds. But the big one is, it's important to remember that the robot is like one big computer. So it actually goes through 2,000-3,000 checks per minute. And whenever it detects something that it doesn't like, it essentially pauses the procedure and makes you address whatever it detects as, something that it doesn't like. So the surgeon will have to fix it before you can actually proceed.
Doug, what would you tell other patients who may be a little nervous about the idea of a robot in the OR?
Well, again, I haven't had too many surgeries at all. I had a rotator cuff surgery, and that was a long process, and it was a very painful process. The robotic surgery, again, absolutely amazing. I mean, I walk out of there and felt fine, and for anybody who would have any reservations about it, I would strongly encourage it. The recovery time, the way I feel today, I mean, I had no issues whatsoever, so I'd strongly encourage anybody to get that.
Dr. Mirza, what's ahead? What do you expect robotic assisted surgery to evolve to in the future?
Yeah, I think, with all the technology that is out there, and technology accelerates so fast, it's going to be hard to predict this. I think the big improvement now is the AI in it, the learning in it, and I think we'll improve patients' outcomes by doing things differently, better, and even more precisely and accurately than we were doing it before. I think our applications are going to expand because robots, instead of looking into one corner of a field and the surgery, can look like 4 different ways now where you couldn't do that because your patient was positioned in a certain way. I think, in terms of telesurgery, this is going to improve. So, if somebody wants to use their expertise and look in and say, hey, I want to learn this too, they can watch our surgery here, and we're working on bringing this to our health system here, where either our own partners or people outside of us can look in and learn from us, and we can learn from other people, of course, as well. And then the next step will be, the initial application or the intention of robotic surgery was to be able to do it in war theater. Like, you dock a robot in a war theater, in the middle of somewhere, and you're sitting in Washington, D.C. at the command post, like doing the surgery from there, from Walter Reed, for example. So that application sort of got lost because we didn't have good communications. We were on 3G at that time, So with 5G technology, with better internet, access and communication, now you can literally do that, and you can be sitting here and doing a surgery in Beijing, right? So I think that's going to improve and bring sort of the experts even to a more responsible level of work. And I think eventually, maybe 100 years from now, this will truly be robotic.
Wow.
Yeah. I think the surgeon is going to be drinking coffee and making sure it's doing his job.
That's right. All right. And you'll just be sitting here doing TV
I'll
with
just
me.
be talking about it, like, hey, check that out. And Aaron will be like, pause it right now.
I love it. All right, let's get to some questions from our viewers this morning. Question is, what robots are being used besides the Da Vinci robots?
Yeah, so that's a very excellent question. It's applicable to us, actually. Aaron runs an excellent program with our pulmonary team using a robot that's called the Ion, and that it helps them also do great work. And it's really, our Da Vinci program and our multi-port, single-port robotic programs are excellent and experienced for a long period of time. This one didn't start too long ago, but it has become one of the highlights of our health system, and they're a high-performing center, nationally recognized for their work as well. Our orthopedic surgeons also use robotic technology, and our spine surgeons do as well. Their technology is a little bit different. It's more related to mapping when they do like joint surgeries and things like that. We also use robotic technology, for example, in I'll give you the example of prostate cancer. That's what I do, where we're using focal treatments for prostate cancer, and you do all the mapping, and then everything is done sort of robotically and computerized. So there's so many applications across the board for robotic surgery besides us. And now we use the Intuitive, which is our industry partner who designs and uses all of our multi-single port robots. But there are other ones out there. Medtronic, Hugo, I think is their brand of robot. Robots are expensive, so I think the next push in robotic technology is how do you can do it in Kansas City, can you do it in Salina, can you do it in rural America and rural world where the capital is not something that we can afford at the health system that somebody else can afford somewhere else. So I think that's going to be the next stage to say is how you can make this technology applicable in an inexpensive way, and those things are happening. So those are the other sort of robotic applications and industry sort of competitions that are going on now.
Question is, and Aaron, I'll ask you, what kind of maintenance do the robots get, and how often?
Well, they get preventative maintenance twice a year, but I feel like we are every day checking in on them and maintaining the system, so frequently.
Quite frequently, I would imagine. Aaron, as we wrap up today, what's the big takeaway from our conversation?
Honestly, it's just been a privilege to be able to be a part of this program and help the surgeons and the staff with it. Robotic surgery is really a great modality, and patients should definitely ask their surgeons about it when getting surgical care.
Doug, thank you so much for just being here.
Absolutely.
Talking about your story and your journey. We appreciate you so much. What's the big takeaway from your story?
Well, I guess my biggest takeaway, first of all, I thank God led me through this journey. There's no question that He had His hand in every step of the way. When you get the cancer diagnosis, obviously it's mixed emotions everywhere. The minute that I met Dr. Mursa, and there was a lot of stuff prior to that. Every nurse you call, you set up appointments. Who's your doctor? Dr. Mursa, he's the best. And that's all I kept hearing. And so I felt like God blessed me, put me in His hands. And again, I would tell anybody who has it. Obviously you have the fear of cancer, but to come here and go through this procedure that I went through, I don't want to oversay, but it's been amazing. It really has. And I just, again, thank God for every step of the way. I believe that He's healed me, and hopefully my journey will inspire someone else. KU staff was amazing. The doctor, Mirza, again, has been amazing. So been a good experience, I guess, if you could say.
Well, thank you
Yeah,
so much for
yeah,
sharing.
yeah.
We're just glad you're here and
Yeah.
glad you're doing well. And
Yeah.
again, thank you for sharing. And we're just glad you're back to your kids.
Yeah.
I know, again,
Yeah.
you're a school administrator, and tell us a little bit about that. Where do you teach? And
Currently, I'm at Drexel School. I'm a K-12 administrator. Been in education for almost 40 years, and so very enjoyable. Get to play with the kids every day. Get to be involved in their lives, and so that's very rewarding. You know, at the end of it, I always say my greatest accomplishment is to shake a kid's hand at graduation. So you know, it really is. So it's again been a very enjoyable experience. Yeah.
well, fantastic.
Yeah.
Thank you again,
Yeah.
Dr. Mirza. So must be great to have patients like Doug sitting next to you and doing well.
Yes, absolutely. I mean, that's the reward we get out of this, and that's the, it's the reward of medicine. And as we're talking about sort of takeaway points, whatever our patients are going through, whatever your family members are going through, it's hard. It could be a cancer diagnosis. It doesn't have to be a cancer diagnosis. There are other difficult diagnoses to go through that may require a surgeon to see you. And I think I tell all my patients this, which is, as you're choosing somebody, choose somebody you trust, because this is a long journey and things can go wrong, things can go well. You got to find somebody who you can trust, who you can lean on to sort of guide you through that process. And how do you realize trust? I think one way you realize trust is by looking at who else trusted somebody, right? What is the brand? What does it bring with it? What is the team that's coming with it? What is the service you're going to get out of it? So, and I think when you look at our robotic program, you look at our health system, our cancer center broadly, that's what you're getting. You can get people you trust because they're experts in their field, they're experienced in their field, they're good doctors. They can shake somebody's hand, they can make them feel at ease. You have 30 seconds to make rapport with your patients. They can either trust you in that 30 seconds or you've lost them, because then they're thinking other things and Google becomes a doctor quickly. So I think our doctors, our teams have the ability to do that and gain that trust, and then also back that up with great work. So I think that's the take-home point from us.
Thank you. Thank you all for being with us today. Thanks to all of our guests. Thank you to all of our viewers for being with us. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update. He's the youngest man in the U.S. to be diagnosed with breast cancer, and now it's back. I'm Jessica Lovell on the next Morning Medical Update. Brett Miller shares his recent cancer battle. We'll also hear from the experts about his latest treatments. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.